Hey guys, I'm Liz. I'm a pediatric nurse. So I did my project on something called ACEs, which stands for Adverse Childhood Experiences Scale. Has anybody ever heard of that before? Okay. So let's get right into it then. So I just listed the objectives first. So first we're going to talk about what ACEs are, where it came from, how they're measured, the impact and prevalence. How do you talk to your patients about this? What's the role? And how do we create an ACEs-informed workforce? We'll go over the core competencies and skills for staff training and the implementation of the 4 E's, which we'll talk about later on in the presentation. Okay, so first we'll talk about what are ACEs. So that's a really nice chart there that kind of basically, it's in a nutshell, early adversity has lasting impacts. So each one of those little lines shows you, I can't actually see it, so I'm going to move up there. Increases your risk for mental health disorders, injury, maternal health, education, infectious disease, chronic disease. And how do we know this? There has been a lot of research. There's a lot of studies out there. There's actually a YouTube video that is a TED Talk, is how I found out about this. It actually started in California with a doctor that was noticing that his patients were losing weight, but then put the weight back on. And he decided, he kind of noticed that they all had some similar childhood trauma in their life, so he decided to run a study for that. And then the CDC went with his findings and they did their own study. So these are all the states across the United States that have participated in the study for the Center of Disease. And it's from 2009 to 2015. So what they did was, there's a questionnaire, it's 10 questions. And in a minute, you guys are actually going to fill out the questionnaire. I have copies. You don't have to turn it into me. It's just for you to see what your ACEs score is and what that means. And they did a physical assessment too. So they found that 40% of the population had 2 or more ACEs, and then 12.5% had 4 or more ACEs. So what does that mean? We'll get into that a little bit later, but first I want you guys to fill this out. So when you finish this questionnaire, 1 through 10, just flip it over so that I know that you're finished, or raise your hand or look at me, something. And you can keep it, you don't have to show it to anybody because it is personal information. So it'll ask you questions like, have you ever, are your parents divorced, or did anybody in your family go to prison, stuff like that. So for each yes, you get 1 point. And there's probably extra copies because I thought there was more people in class. Okay, y'all finished? Okay. So, what's the prevalence of ACEs from this study? There is a 2011 National Survey of Children's Health that showed that almost 50% of children from 0 to 17 had scored at least 1, and 22.6% had 2 or more. Now, that is for children 0 to 17. On the other side, there's been 2 comparative studies, and we talked about the CDC, but there's another one from Kaiser Permanente, and they combined them. So that's a total of 54,000 adults. And what they found was that the most common ACE reported was physical abuse at 28.3%, and then household substance abuse, which was 26.9%. And also 1 in 4 women reported a history of sexual abuse during childhood. So what does that mean? That means that they actually found that the higher your ACE score, the more you're at risk for chronic health conditions in adulthood, like multiple chronic or persistent stress can impact a child's developing brain. So there has been a relationship between ACEs and these high-risk behaviors. So for example, if your score is 4, that increases your risk of COPD by 400% and your risk of suicide by 1,200%. So it's pretty shocking when you look at it, the correlation between something as simple as 10 questions and your health. And I feel like nursing is getting more into preventative care, so we should probably use this research to do some work. In my research, I found that the barriers for using ACEs in practice was that people felt uncomfortable speaking with patients about these personal issues, feeling that, they're taboo and it's an invasion of privacy, or they're not aware of ACEs or what the importance of it is, or not realizing the impact that we have to help build resilience, and trauma-focused care in general. So on the other side, I put examples to kind of help build that gap of how you can talk to patients if you're uncomfortable. You could just say, like, has your home life changed in any significant way? Has anything bad, sad, or scary happened to your child lately? Do you have any concerns that your child's being exposed to stress or something that would be scary to him? So what's the role of the healthcare provider? So the healthcare system is a natural place to respond to this problem and to promote resilience in children. So since I'm a pediatric nurse, I put pediatrics on there, but it can really apply to any practice, so just use your imagination. Pediatric nurses and providers are in a unique position to identify issues for both children and their families. And I found a quote here from the American Academy of Pediatrics, which says, nurses and physicians need to take a more proactive role in educating parents and families about the impact of toxic stress and for advocating for the development of interventions that mitigate its impact. So my proposal is to create an ACEs-informed workplace. And how would we do that? By conducting an organizational assessment of policies, practices, and capacity to implement ACEs into care. So basically, look at our policies and see if that's something that we would want to do. And then we would have to do training for leadership and the staff on ACEs. And then we would have to have a organizational culture change to align with ACEs principles. So for staff training and leadership training, I just listed the skills and the competencies that we would have to use. So we have to make sure that everyone understands the neurobiology of toxic stress. We would have to focus on interpersonal interactions and creating safe, stable, nurturing physical and social environments. Self-reflection, we've all heard that in nursing. That's one of the reasons I made you guys fill out the paper. And activation of self-care, self-management of difficult emotions and behavior. And then again, we have the 4 E's. So we'll get into that next. So what are the 4 E's? Educate. So that would be, this is basically the plan that I would implement. So for education, it's a systematic education of staff of the things that we just talked about. Empathize. Providers and staff should consider how trauma has affected their patients, their health, and their behaviors. Explain. You want to continue that trust building with your patients, and you want to create and maintain a safe environment. And empower. So the main goal of this knowledge would be to empower individuals to improve their health. It's important not to advise the patient, but to give them the resources and education. So here I have our measurable goals and target dates. And so what I would do for change is have everyone who works in direct patient care, so all the doctors, all the nurses, PAs, NPs, they will receive the core competencies and the skills training to implement the education from the 4 E's model. And I put 8 weeks to learn all of those competencies and skills starting today. So you have 8 weeks from today to get your education done, your competencies, and check off on that. And then all members of the implementation will partake in their own anonymous and personal assessment of their own ACEs in order to empathize, explain, and empower this movement. So I really like that 4 E's because it's something you can remember, and you guys already did that. So you can see, I think it just gives you some self-reflection about why it's important. You can kind of look at your own life, or you can understand, somebody close to you that's been through something when they were a child, and then you think, okay, yeah, that makes sense. So after that, all the members will review and understand new policies. So my proposal would be a new policy change where it's basically a trauma-informed care, where you would have, at the end of the educational training, we would have to start using ACEs in practice. So my proposal would be that you would have to put the ACEs score in the medical chart during the initial assessment of every patient when the program goes live. So after 8 weeks from getting your education done, and I did put failure to do so will result in corrective action, only because my idea would be it's a policy change, and it's expected that you know the policy, and then this is what's going to happen. So it's a lot to learn. So there's probably going to be resistance, and I talked about some of the barriers earlier. So I think education would really be the best thing to get rid of that resistance and focusing more on preventative health. You're not going to be able to help everyone, but at least you'll be able to understand where they're coming from, and you can put them in the right direction at least. And it doesn't, we already ask a million questions on initial assessment, so it's not going to hurt for them to fill out 10 questions or just to ask them a little bit more personal questions. It's uncomfortable, but it could be really helpful for the patient in the long run. So this picture right here is just something I found on the internet. It's not real, it's hypothetical. But what I would do for such a big change would be to have a party. So after everyone does all their education, I would have some keynote speakers come and talk about ACEs. And I would make it a community event so people could come and learn about what ACEs are, and that we're going to use this in our hospital. And I would like to have it approved that you get CE credit for the education that you did in ACES. And of course, you could use it on your resume. So those are some incentives. You know, it goes towards your nursing license. You can use it on your resume. You get credit. And we want as many people involved and understanding what that is as possible. So this would be, my idea would be like a pretty big event, like a community event where we would spread the word. So I have a lot of references. If you guys are interested, check out the YouTube video on ACEs. It's a TED Talk. I don't know exactly the name of the lady, but if you just type it in, TED Talk ACEs, it'll pop up. It's really good. It's interesting. Okay.